Have you ever asked yourself, why is there so many antibiotics? And why do they help sometimes and sometimes they don't? Today I'm going to talk to you about antibiotic resistance. I'm going to talk to you about prescribing antibiotics, viral versus bacterial infections, antibiotic resistance, what the CDC is currently doing to help us, and why are we not making new antibiotics? I was completely aware of the problem until I entered a microbiology class for the nursing program. She showed us a couple videos and gave us information on antibiotics and their resistance. First lesson of antibiotics. They do not work with viral infections. Viruses cause many ailments, such as sore throats. It's impossible to determine whether the sore throat is bacterial related or viral related. So they do a culture to perform, or they perform a culture to see whether it is bacterial or whether it's viral. The proper use of antibiotics is to destroy bacterial infections. Antibiotics can save lives when used correctly. Why are we hearing of antibiotics not doing their job with bacterial infections? Antibiotic resistance is occurring. The bacteria change or mutate in some form, eliminating the effectiveness of the drug. The antibiotics can lose the ability to kill the bacterial growth. You ask, what causes the bacteria to mutate? There are a couple different factors that go into this. There is the improper use or excessive use of antibiotics. According to a study done by the University of Washington in the Seattle Children's Hospital, the dates 2000 to 2010 was a study conducted. They determined that antibiotics are being prescribed twice as much as actually necessary. Taking an antibiotic when it is not necessary can cause more harm than good. The antibiotic will kill the bacteria in the gut, but some of that bacteria is good. We need that bacteria. So when it kills the good bacteria, it allows room for the bad bacteria. An excessive use or taking antibiotics when they're not completed, and that also creates a problem. Excessive use of antibiotics can allow the bacteria to recognize the antibiotics and change and mutate in form. It can change the binding sites. There's a couple different ways that they can do that. Taking an antibiotic to only half when you start feeling better and not to its entirety can also be a problem. If you take antibiotics to get better, start feeling better, stop taking the antibiotics, it kills some of the bacteria but could leave some of the more harmful potent bacteria. So that also could be a huge problem. The following graph shows dates of the introduction of the antibiotic versus the resistance shown. So here I have a graph. The first antibiotic to be developed, of course, penicillin. 1943 was the date it was introduced. The sign of first resistance was 1965. The last drug right here, it's ceftaroline. It was introduced 2010, and it showed signs of resistance in 2011. So it just shows you that antibiotics are showing resistance more quickly than they used to. That last drug only a year, and several of those through there only a couple years being developed did it show resistance. So what is being done to assist in this serious problem? Like previously discussed, it is difficult at times to determine whether it be a bacterial or a viral infection. So the CDC has come out with a campaign called Get Smart. The Get Smart campaign, and I've listed the link for you to click on, it provides a graph, and it tells you, it just helps you know when antibiotics should and should not be administered. Like, for example, it gives otitis media. It wants you to have the ear infection for 3 days before you actually prescribe an antibiotic and fear that it's just a viral, it's going to run its course. If it's past 3 days more serious, you might actually need an antibiotic because it might be bacterial. So there's a couple different guidelines through there that helps you to determine when an antibiotic might be needed. With antibiotics rapidly showing resistance, why are new antibiotics not being developed? According to the World Health Organization, new antibiotics are not being developed because of the following reasons. It takes billions of dollars to develop a new drug. antibiotics are not providing the return on investments. So the drug makers, they're making tons more money for things like blood pressure meds, like chronic illnesses, where an antibiotic, you take it for a short time and then you're better. And then another reason is the antibiotic resistance. You know, they're spending billions of dollars to create these antibiotics, and just a year or two later, they're showing resistance. So it's not getting return on their investments. Lawmakers are considering and offering companies perks like tax breaks and patent extensions to try to regenerate the development of new antibiotics. So we shall see if that perks up interest in the drug makers, drug developers. In closing, I have just informed you about the use of antibiotics, the problem with the resistance, and some suggestions in assisting to help the problem. I hope you enjoyed and learned something about antibiotics today. Thank you.